Well, hello everyone. Thanks for joining us today for the MarkeTech Group's next in a series of our webinars. This one on how to optimize your sales force effectiveness. I'm Robert Enzrink, a partner and a senior consultant with the MarkeTech Group. We're specialists in medical technology marketing research and strategy consulting. The MarkeTech Group provides these webinars to share experiences we've learned in the hopes that some of the marketing research techniques we share can be useful for you to develop your business. In this case, we'll share one approach to improving your sales force effectiveness. Now, a few of you have submitted questions to the MarkeTech Group prior to today's webinar, and we've incorporated those into the discussion wherever possible. Also, as you have questions during the webinar, we encourage you to text questions into the GoToWebinar question box, and we'll address as many of those as we can during the discussion or at the end of the discussion. With respect for everyone's time, let's get started. So, what if medical technology sales reps could improve their success by communicating the right message to the right customers at the right time? And our contention is that they can. But before sales reps can think like a customer, they need to understand how the customer thinks. And we have a methodology that we've used successfully with a number of our clients that helps companies to better support their sales reps, to become more efficient, and to basically get into the heads of the customers. And the challenge is to eliminate the biases to understand the objective perspective of the customer. The marketing professionals in the healthcare industry, and really any industry, try to align product and marketing with a customer's needs and wants, while the sales reps try to convince the customer to purchase their product based on better features, benefits, service, sometimes price, and customers continue to tell you that the price is most important, and they claim that they're going to purchase from the lowest price competitor, you're in a competitive bidding situation, and price trumps all. But we know, as you do, that customers don't always buy the lowest price product. So you need to align your message with what your customers value, of course. So let's take a look and see what this really means and discuss a few of the tools and methodology to help your sales reps get into the heads of your customers. So one solution is to compare what sales reps believe customers think is important versus what your customers actually value. One tool to do that is a importance and satisfaction plot that you see on the screen now. So for example, your sales reps perceive that customers think service is somewhat important, and that they're extremely satisfied with the service that they're getting today. Similarly, the sales reps know that feature one is that the customers are somewhat satisfied with feature one, but they think feature one is not very important. However, if these same questions are posed to your customers, customers actually feel that feature one is extremely important and they're extremely satisfied with feature one. Likewise, in terms of service, both the sales reps and the customers know that service is important, but the sales reps believe that your customers are extremely satisfied, whereas the customers themselves are not at all satisfied. They're really not as satisfied as they could be. So what does this mean? What this means is there are some opportunities here. For example, feature one, which your sales reps don't feel is very important, they're probably not leading with that. They're probably not highlighting that when they're pitching their products, and yet your customers feel that that is an extremely important feature. Not only that, your existing customers are extremely satisfied with it. So what that means is this is clearly an opportunity when approaching new customers to highlight a feature that is very important, and your sales reps might not be doing that. Not only that, any testimonials or calls that your customers will make to get testimonials are going to have a very positive response. So maybe the sales reps are underrepresenting, underreporting, and certainly not highlighting enough feature one in this type of a scenario. So how do you identify what these gaps are? How do you identify the gaps of what your sales force thinks customers value versus what customers actually do value? And we have a process that we've used successfully where this can be done in 5 steps. Most marketing research programs include step 1, 2, and 5. And most often, if this is done right, this can provide insights into the customer. Step 1 would be interviewing customers and sales reps to get the lay of the land. What are the things that are important to them? Who are the key stakeholders? Who are the decision makers? Step 2 is to survey those customers and potential customers and identify what their needs are. And then, of course, what typically happens with marketing research is that information is, if it's used at all, but if it's done well, if the study's done well, you'll get actionable results, and you'll be able to align your sales and communication strategy with what you learned was important to your customers. So, and if that's done right, you could get useful information like segmentation of your customers, identifying the value propositions or the relative value propositions, what are the purchasing decision factors, pricing information, and so on. However, skipping steps 3 and 4 by not surveying your sales force's understanding of your customers may miss gaps in understanding between your customers and your company's alignment with your customers. So we recommend, if there's a concern or an opportunity to improve sales force effectiveness, take the same survey and survey your sales force, and then analyze the differences in the perceived importance that your sales force has with what your customers are really telling you. After all, who represents you to your customers? It's your sales force. Who's the face of your company? It's your sales force. And when choosing which products to present, which things to highlight, which items or services to lead with, what features and benefits do they highlight? It's your sales force. And does your sales force really know your customers? By skipping steps 3 and 4, key opportunities can be missed. Like you saw in that important satisfaction plot, if a sales rep recognizes something is important but underestimates how important it is, because customers don't, when sales reps underestimate how important it is, maybe because customers don't complain about it, they're very satisfied with it, but it's really important to them, the sales reps may not gather and sense how important that is, especially when talking to a new customer. So by skipping steps 3 and 4, you might miss these key opportunities. You might miss an opportunity to better align internal training and messaging to true customer needs. You might miss an opportunity to define an R&D roadmap that will really excite the customers. If there are certain features or capabilities that customers are looking for, but it's filtered through a sales force's biases or your key opinion leader's biases, you may miss that. You may miss an opportunity to better target your key stakeholders with their value proposition. Maybe it's not the clinical decision holder that's the key decision maker here, but it's the economic stakeholder. You may miss an opportunity to identify where competitors are gaining traction, or if you're compromising your good reputation. Generally, salespeople will think very highly of themselves because they've been constantly conditioning themselves about how great they are, how great their products are, and how wonderful your company is relative to competitors. Well, let's go through an example. One example would be to uncover the most important product features. How do you find out what features are most and least important when considering the purchase of a product? You can present this type of a survey. This happens to be a max-diff exercise, which is maximum differential scaling technique, but max-diff. You can provide the same survey to your sales reps and to your customers. You could do this either of 2 ways. One, you can ask the sales reps to role play a customer on the identical survey. This is preferred. Or you could provide a reworded survey with the same questions targeted specifically to your sales reps. However, you have to be very careful if you do a reworded survey that you retain the exact meanings of the survey tasks. So as I mentioned, one methodology to use, and there are many, you could use conjoint or straight declarative, but this method happens to be max-diff. And the marketing research of this nature can provide objectivity of decision making. Your sales reps answer the questions, your customers answer the questions, and you avoid the bias once you aggregate results of your entire sales force, or a large portion thereof, and a number of your customers. You'll start to see trends. And this can help, in this case, when you're looking at most important features, can help drive R&D and product portfolio strategy. You can test in a reasonably efficient survey of a reasonable amount of time up to 20 different features or variables using this particular technique. Another example would be determining the ideal frequency to visit customers. Using the same max-diff technique, you can get objective assessments of what customers really feel versus what the reps perceive. Now, of course, every customer is unique, and sales reps by nature tend to be in tune to their customers. But that's their customers, not new customers. This knowledge is useful particularly for new sales reps, for new accounts, new customers, and for sales training guidelines. Guidelines that say for this segment, these people expect a sales rep to visit approximately this amount of time. Or we've been calling on this segment too much. They find it annoying. Maybe we need to reduce it from once a week to once a month or once a quarter. And we've encountered many examples of key stakeholders that actually would like to see sales reps more often. It's a bit surprising, but it happens fairly frequently. And not only do they tell us how often they'd like to see a sales rep, but also they've told us what they value in their sales reps. So another example would be to uncover what characteristics customers seek in sales reps. For example, you can find out what is most and least important in a company's sales rep, whether it's responsiveness, knowledge of product, or competitive knowledge, speed. Is it product knowledge, competitive updates, maybe technical support, initial training or ongoing training? Should that training be remote or at the customer site? What is it that's most important to your customers? And this is very useful for sales training. It's very useful for operational support. If you find that the sales reps underestimate the importance of technical support or uptime, maybe you could support your sales efforts by improving the availability of technical reps rather than additional sales reps. So this line of questioning could identify where there are opportunities to take a competitive edge. Sales reps tend to have a little bit of groupthink mentality even among competitors. And if you can identify an unmet need of customers that the sales forces haven't yet identified, all of a sudden you can prepare for that, proactively go after that. So when we look at the results of those types of questions, they reveal how the sales reps and the customer perceptions differ. Let's look at the left set of bars and the importance of feature 1. Both customer segments, customer segment 1 and 2, have a very, customer segment 2 rated this at 10 on average, have a very high importance for feature 1, and the sales reps, although they know it's important, underestimate that by about half. Maybe feature 1 needs more attention. Similarly, looking at the center set of bars, the results we saw with this particular line of questioning for this study was that the importance of visiting the customers once a week, and of course we asked about different time frames as well, was more important to customer segment 2 than customer segment 1. And maybe the sales rep should err on the side of more visits to customer segment 2 and reduce the visits for customer segment 1. And finally, looking at the results of the question about importance of sales rep responsiveness, responsiveness was rated very highly by the sales reps, much more so than the customers did. What this suggests is maybe the sales reps can spend a bit more time cultivating new accounts than reacting to the existing ones. Maybe the sales reps highlight this and feel it's more important because when they're not responsive and there's a problem, they get a lot of flack for it. There's a lot of pain associated with that. And heuristically, we tend to consider problems or pain points with a higher level of influence than positive reinforcement. So this is not an unusual finding. So how about a real-world example? Let's take a look at a particular case study. This is for a client, a research project we did for a client that was a dominant market leader. They were an industry first mover. They created this segment of the industry, and they had over 70% market share at this stage. They offered networked this particular product line where they were the first mover and the dominant player was a networked hospital equipment. They were looking to launch a new product to replace an existing product. So the study was primarily a product portfolio road mapping study. And they had a number of challenges, including what's the purchase process, who are the key decision makers and influencers. That initial growth of being the first mover, creating a new market, was starting to level off. So they wanted to know what's the preference for different product and non-product features, pricing. They wanted to model the impacts of different decisions on their 5-year profits and sales. But a key component of what we want to focus on today is they also wanted to understand possible improvements to sales force effectiveness. They had been experiencing market share and sales erosion because of competitive entries. There were now 2 competitors already in the market with a 3rd coming. They had seen sales slowing. Prices were dropping. Their average selling price was dropping. And their sales force efficiency had been decreasing in terms of dollars per sales rep. So what did we do for this part of it? In this case, for this product line, we learned that the economic decision makers were more influential in the final go, no-go, or buy decision than the clinical or operational decision makers. The clinical and operational decision makers still were influential. They still had to support the product, but the final go, no-go decision was really made by the economic decision makers. And when looking at how those economic decision makers, the finance department, the CFO, CEO, the department heads, analyzed the different payment models and pricing structures that were offered, a majority of the customers preferred a formal discount analysis. So these economic buyers reported that about 2/3 of them did a discounted cost of ownership analysis that included all direct and indirect costs. So this was a net present value, discounted cash flow type model. An additional 20% did a discounted cost of ownership analysis that didn't include all the direct and indirect costs. And then a further 16% did a simplified cost of ownership analysis, not accounting for time value of money. But almost none of them, virtually none of them, did something other than this. The clinical buyers, interestingly, reported that their financial department actually did, on a higher incidence, a more thorough analysis. So one can imagine what goes on in those hospitals, that maybe the clinical decision makers felt that it took a little too much time or took a lot more effort than they expected, required more input from them to put these economic models together. But nonetheless, even the clinical buyers recognized that a very thorough discounted cost of ownership analysis, including all the direct and indirect costs, was being done, and it's probably because they were the ones that were being asked to capture a lot of these cost drivers. However, when the sales force was given the same survey, they reported only about 1/3, about half the incidence of their customers using a discounted cost of ownership analysis, very thorough formal cost analysis. And importantly, 38% of them had no idea. Now, what does this suggest? First of all, the sales rep don't know the economic decision-making process, so are unprepared to sell to one of the key influencers and, in fact, the final go-no decision maker. Secondly, the sales reps also underestimate the importance of a financial analysis that includes overall cost of ownership. So the impact was that the sales reps underestimate the importance of this cost of ownership analysis, and as a result, they were not as well prepared when closing the deal as they could be. In addition, the sales material that the company was presenting didn't highlight the total cost of ownership benefits of the client system. So this was a good example where, number one, the sales force, by seeing this information, would have an objective presentation in front of them saying, look, in order to sell this, you need to be ready with a formal discount analysis and not just present a pricing plan, but you need to provide data. And by helping that economic buyer make the go decision, you'd have a better chance of success. Similarly, in this case, the material that was being prepared for the sales force wasn't adequate to meet this need. So the company retooled and provided more thorough support for the discount analysis for this type of product in terms of materials, additional plans, pricing plans, and making people available in the home office to help prepare a cost of ownership model and work closely with the economic buyer. In addition, the economic buyers strongly preferred a lease for this type of product. When we asked about the payment model, you can see that the economic buyers some of them wanted a capital purchase. That certainly needs to be an option, but they had a strong preference for a lease model. The clinical buyers were fairly ambivalent between a purchase and a lease, but the sales force, although they understand a lease was valuable, they did not understand the strength of the value of the lease programs that were being made available to their customers. So this, by the way, the methodology used for this is extracted from a conjoint study that measures importance. So the findings that the marketing research highlighted: the sales reps don't know the value of the available lease options, so maybe weren't highlighting that as much, maybe weren't leading with the benefits of the lease options or even the various lease packages that were available. So rather, the sales force was focusing on purchase price, on discounts, and they were effectively leaving money on the table. In this case, what the client did was the attractive lease plans, which could be very profitable for the client, were highlighted. In addition, alternate lease packages were developed, and they were highlighted in sales training and the MarkeTech materials, and additional financial support was provided at the home office. So here, the perception of the sales reps, which will drive a lot of the marketing decisions and product development decisions in the company, really underreported how important these lease plans were to their customers. Once the objective assessment was provided, the company could make adjustments to be more competitive and retain their dominant position in the market. Finally, a third bit of data that came out of this study was of the newer competitors. I mentioned there were two competitors in the field already, competitor 1, competitor 2, and a third about to enter, which of course couldn't be reported on. When we look to the economic buyers, the squares, and the clinical buyers, the X's, they tended to prefer or feel ambivalent about the client. Competitor number 1 was a little bit less preferred. However, competitor number 2, you can see that both the economic and clinical buyers have a higher preference for competitor number 2 than the sales reps expected they would, by a large margin. So this identified complacency where the sales reps really underestimate competitors relative to customers. In this case, relative newcomer, competitor number 2, was improving their brand, improving their reputation, and a main reason for the market share being taken away from our client, who was the first mover. It identified that competitor number 2 was a stronger threat than competitor number 1, which is contrary to what the sales force believed, and most of the competitive sales were being geared toward and targeted toward competitor number 1 rather than 2. In subsequent research, it was determined that competitor number 2 was also highlighting lease programs, and their sales reps were perceived as less arrogant than the market leader. So what's the impact of this finding? The client tailored its positioning and their competitive materials to target this newly identified competitive threat from competitor 2, which it had not done before. Competitor 2 was more highly regarded than expected, so they recognized they need to address both competitors. And the client was able to use this finding to refocus the sales pitch, importantly, to proactively address the newly identified threat posed by competitor 2. By being proactive, it avoided the sales reps from appearing defensive and allowed them to tackle this head-on. It ensured that the sales reps knew that both competitor 1 and 2 were viable competitive threats and not to rest on their laurels, to continue to maintain their brand and continue to promote the lease packages and the product features that were most important to the client. So this is a case where it's easy for sales reps to underestimate the competitors because they tend to drink their own Kool-Aid. They're constantly reinforcing for themselves how strong they are and why they're better than the competitors. The sales force doesn't always see what the customers see in time. So, marketing research can provide objective comparative analysis of customer and sales force perceptions. It's an outstanding method to avoid those internal biases. The biases of your key opinion leaders, your product champions, the biases of your sales reps, they have this unconscious internal bias because they're constantly pitching and selling your product, drinking the Kool-Aid. By understanding your customers better objectively and avoiding the internal and sales force biases, you can identify opportunities to improve your sales force effectiveness. You can do this by targeting your marketing communications and materials and improving sales training. Right? Focus that training, focus retraining if necessary, on what the customers truly value. You can emphasize your strengths. Focus the sales and messaging material on and messaging materials, your MarCom, on your strengths. Provide the sales reps with the tools that really provide value to your customers. If that feature 1 is extremely important to your customers, but they're extremely satisfied, the sales reps may not know how important it is because they don't hear complaints. But a new account, that's something you might want to lead with. You can align product development with customer needs. R&D efforts can be guided to provide the products with which your sales force will be more successful. Try to avoid, particularly for R&D, those biases that come from your key opinion leaders. They're your product champions. They're already your friends of the firm. What you need to do to grow your business is find those people that are not the friends of the firm. And usually that's the bigger part of your market. And finally, you can improve important weaknesses. You can identify weaknesses and competitive threats. You can promote proactive selling. So that really wraps up our overview of one approach to identifying opportunities to improve sales force effectiveness. On behalf of the MarkeTech Group, we'd like to thank everyone for your time. If you have further questions about a particular section, or if you have a question about designing a study, we're more than happy to help you with that. We're here to answer your questions. It's what the MarkeTech Group does, so contact us. After the webinar, please take a moment to complete the survey. Remember, MarkeTech Group, we're a medical technology marketing research firm, so we really do appreciate and thrive on your feedback. Good day, everyone, and we look forward to talking to you again in the future.